When I was 50, I had the Wellman check, checking your bloods, checking your weight and checking your style of living. I wasn't able to empty the bladder and I was going very frequently. I was waking up in the night. I wouldn't drink it during the evenings. I wouldn't drink during exercise. So it was constant. It was always in your mind. I was frightened. I was referred to the hospital. The doctor took bloods and the prostate was large. That highlighted a high PSA score. Once I was diagnosed with BPH, I was put on medication to help reduce the prostate and to aid the flow. I was just struggling more and more, but I was very mindful of the traditional forms of prostate operation, so I was afraid of going down that route. I wasn't eligible for stronger medication. A potential option for me would be aquablation.
Greg was referred for consideration of aquablation, and actually I took him through the full range of options. We agreed on aquablation for a number of reasons, which included the excellent urinary outcomes, but also typical excellent sexual outcomes in terms of preserved erectile function and ejaculatory function.
For me, that was a huge part. I had a big tick for the aquablation, knowing that, a retained sexual function would be, limited.
His operation went well, and actually the most impactful thing really is he's recovered so quickly.
It's less invasive in terms of that they're using water jets to actually reduce the size of the prostate, but it's a lot more accurate, it's a lot more precise. I didn't feel any discomfort. It was a pleasure to kind of be there, to know that you're in safe hands.
When I saw him in the waiting room afterwards, I knew from the broad smile on his face he was a happy patient.
The following morning, I was in good shape, and it was amazing, really. Exercise is really quite important for me. It's a good escapism. Since I've had the operation, I returned to the gym, within 3 weeks. The future's bright. Going out, going away, going on holiday, going, just to watch a rugby match. It's a lot more calm. You don't have to plan your day. You could just go out and just have a normal life, I guess. For anybody suffering a prostate problem, then if aquablation is an option for them, then I would grab it with both hands. It's been a real blessing, really.
Benign prostatic hyperplasia, also known as BPH, is one of the most common prostate conditions for men over 50. It occurs when a prostate grows to be larger than normal, constricting the urethra and making it difficult to urinate. Hello, I'm Derek Griffiths, and for a decade I've lived with a condition called benign prostatic hyperplasia, or BPH. Living with BPH was difficult. There was a stage before the procedure where I was wearing a catheter for about a year, and in that time I was working the theatre in London, and it wasn't easy. The problem also is, when you're working in London, going from A to B, you've got to map out where the toilets are, because every 15 to 20 minutes you need a loo. I was taking pills for 4 years, hoping to shrink the prostate, which never happened. Consultants that I talked of the old operations, which I wasn't sure how it would leave me. So hence why I did all the research into aquablation.
The disease of BPH is a chronic increase in the size of the prostate gland, which can restrict patients' ability to pass urine, and it can become increasingly troublesome as they get older. Prostate disease is a very personal disease, and it can have an impact upon patients' ability to engage in sexual activity, particularly libido, ability to ejaculate. These type of factors are also important. If we assume that the patients have been on the medications, they've tried the medications, their symptoms haven't really responded, you're then looking at some kind of intervention. The most recent form of treatment is the robotic aquablation.
Aquablation therapy is a unique, advanced, minimally invasive treatment that uses imaging, robotic-assisted technology and a heat-free water jet to provide long-lasting relief with low rates of complications.
The advantage of the aquablation treatment is you do use a telescope to keep the instrument, called the handpiece, in position in the prostate gland, but we use an ultrasound in order to look at the size of the prostate gland, the shape of the prostate gland. And using this technology, we can create a treatment plan that is very defined. When you get down to the part of the prostate gland that contains some of the ejaculatory duct functional area, the danger is if it sweeps all the way across, it would impact upon ejaculatory function. And what's nice about the system is it gets to that level, and having done this, it then starts to make what's called a butterfly cut, and it just cuts this way on one side till it completes the resection, and then the machine stops, and then it goes back out about a third of the way along the prostate, switches to the other side, and it does the same thing the other side, preserving tissue around what's called the verumontanum, which is where the ejaculation comes from, and also the intersphincteric area where the urethral sphincter is. Once the patient has recovered, they'll usually go back to a discharge area. Patients will have a catheter in for 2, perhaps 3 days in some cases, and most patients are getting back to normal activities within 2 to 3 weeks.
I can remember leaving the hospital after the procedure, and I love walking. And walking had been difficult. And I walked to Waterloo Station, which is about 2.5 miles. And I realised for the first time in years, I could walk without pain and discomfort. And also, I got to Waterloo, got on the train, and got home and realised that I hadn't needed a pee. Sex life. I had great nightmares of losing it. It went back to normal, which was amazing, because I didn't think it would. My life changed dramatically after the procedure. Do not hesitate, because it only gets worse and worse as time goes on. And to escape that, get it done.
BPH affects millions of men. Aquablation provides a solution for these patients without the risk of some of the side effects of medications and other treatments. And it is a technology that is becoming increasingly available because of patient interest.
Please, don't wait. Speak to your doctor about aquablation therapy.
Together, we can help more patients improve their symptoms and regain their quality of life.
Aquablation therapy is NICE approved and offers a minimally invasive, effective solution for lower urinary tract symptoms caused by BPH. If you would like to find out more about this BPH treatment that has benefited tens of thousands of men worldwide, scan the QR code or visit aquablation.co.uk.